Hey everybody, it's Patrick and it's after work. It's 5:15 on Tuesday, and the admission that I thought I was going to do today ended up not happening. And that happens sometimes with admissions, you know, somewhere in between being in the hospital and getting home, a lot of stuff can happen. So the admission that I was planning on doing today I did not do. However, I did visit somebody on my caseload who needed an extra visit because there was some stuff going on, and then I got a request to do an after-hours visit for a new admission. That was just a tuck-in visit. They're going to do the full admission tomorrow morning, but I was just going to stop by and just check on the patient tonight, make sure they were okay for overnight, and they were, which is always good to see. I did some teaching about safe transfers because this particular person was having trouble getting out of the couch using a walker, so we went over some transfer techniques, and it's one of the things that I really envy about the physical therapy line of work, that, you know, people are so happy when you show them a really simple technique that makes them going from like being helpless to being able to help themselves. So that's kind of a good feeling. I could never be in the physical therapy or occupational therapy profession because it seems to me to be too specialized. I don't like specializing. But that is one of the fun things that I've learned from working with physical therapists. So I can train people in transfer techniques sometimes, and that's a lot of fun because it makes a big difference to people. I'm just pulling into my sister's school right now. I'm picking my sister up from work, from school again, from work. So my co-star will be back with us shortly. Let's see. Is she waiting for me? Did she get the message? She should be right here. There she is.
Hey Pat, thanks for coming to get me.
Yeah, no problem.
So let me guess, they had more work for you than just checking someone in?
Yeah, they did have more work for me. I was just explaining to my studio audience here.
Ooh.
That
The folks at home.
the folks at home, yes. I was just explaining that the admission ended up not happening in the first place, so they had other stuff that they needed me to do. I got bawled out by a doctor today, which is always fun. I always enjoy getting bawled out by doctors.
Was the doctor right or wrong?
Very wrong. Doctor was
okay.
very wrong, and I think that was why he was bawling me out. Basically what had happened was another nurse had seen this patient who was having more and more trouble breathing, so she called up the pulmonologist and asked for an order to increase her daily long-acting morphine. This is all what I heard. I wasn't there when any of this happened. So when I saw her today, she was oversedated. She wasn't breathing. She was breathing like 6 times per minute, which is not normal. She was very tired and lethargic. And what led me to believe that she was oversedated was that when I was giving her a lot of tactile stimulation and percussing on her chest, and I got her to sit up, and we walked up and down the hallway a couple of times, she perked right up. So that suggests to me that she was oversedated. So I called up the doctor to ask about like the breathing treatments with the nebulizers, like maybe we could do those more often instead. She had these really horrible wheezes. She was wheezing really badly. And he just goes off on me. It's like, you people don't understand. You're giving her too much morphine for dyspnea. What do you expect? Of course she's going to have more trouble breathing, and this is a stupid way to do things. Why are we prescribing over the phone and blah, blah, blah. And what I wanted to say about what I didn't was like, well, you prescribed the medication initially, you know. Like, this was your order. You could have just not prescribed that medication and we wouldn't, you know, be in this mess. But I agreed with him. I was like, yeah, you're absolutely right. She's had too much morphine. I would like some different orders. You know, like, what about this? Can we give her some Mucinex, blah, blah, blah. And so this doctor was like, well, if the patient's daughter wants new prescriptions, she can call me herself, and then hangs up on me. So, whatever. I mean, it didn't really change anything that we did, you know. We still had all the actual stuff there for her breathing treatments and stuff. I was going to ask about, like, yeah, you know, some Mucinex or something, but she was fine once I got her up and walked her around. I think the problem mainly is that he just stays in bed all the time. He doesn't have anybody to socialize with, you know. So we're sending volunteers over, so she has somebody to sit up and drink coffee with and, you know, kind of BS and stuff. And that's always helpful.
BS, it's what keeps us going.
BS is what keeps us going, yes. So what did you do in school today?
Oh, just the usual. first year experience, art history, and then sitting in the student lounge while video game club members make dirty jokes.
Sounds exciting.
Thrilling.
Yes.
Yeah, that doctor sounds like a bit of a dick.
Yeah, he was a jerk. And then by comparison, you know, I was reading through the chart of the patient that I was visiting to do a tuck-in visit for, and I came across this great letter from her oncologist that this really awesome guy by the name of Dr. Newton, really class act guy. He's like a young guy too, he's around my age. And there was this wonderful letter that was in this patient's chart that said, you know, dear so-and-so, you know, I know that you haven't been to the office lately and that you don't have any insurance anymore, but anytime you want to come in, I'll see you free of charge.
Aw, that's really sweet.
That was really nice of him. And then her, this patient's primary doctor, GP, did the same thing. You know, was prescribing medications for her and, you know, visiting her and stuff without taking any payment. So that's cool. Still see some really neat guys. But then you've got the other ones that refuse to do anything unless the patient comes in so they can bill Medicare, you know. Like as was the case with this pulmonologist I was getting bawled out by today.
Because obviously the people who most need medical treatment are the ones most able to go to see the doctor physically.
Right, yeah, right. No, we run into that a lot in home care, you know, because a lot of the people that we see can't leave the home, or it would take, what does it say on the form? Considerable and taxing effort. Patient cannot leave home because it would require considerable and taxing effort. Yeah, which I think that's fair enough. You don't want to tax these poor people any more than they're being taxed already. So we've got social work interns at work again.
Social work interns.
Social
I bet
work
they're
interns.
bright and shiny.
They are bright and shiny and very cute.
Aw. Someone new to regale with all your nursing stories.
Yes, I suppose.
I always love a new person to tell my stories to.
Yeah.
Mostly because I've already worn them down to death with everyone else I know.
Yeah, somebody at the bar yesterday tried to convince me that all of my personal problems would be solved if I just didn't bring my laptop or a book to the bar. I don't think she gets it.
If only you were bored while drinking.
Right.
Everything would be solved.
Yes.
Really, man. Your unhappiness, all down to this reading thing. I never trusted it.
Well, you know, I'd bring all my homework down there because if I sat around at home and did my homework,
you would slowly go mad and suffocate in isolation.
Yeah, it's lonely, you know. I'd rather go do my homework around other people, you know.
Yeah, I can see that.
I just found out I have an extension on this pain presentation thing. I thought it was due tomorrow, so I was freaking out about it. Just like staying up late working on it because I only had one more day for the deadline.
Yeah.
And now I've been told that since we're printing it up in-house and we're not making one of the hospitals print it up, I've got until the middle of next month.
Oh, that's good.
So that's nice. I'll be able to, what I want to try to do is like replace a lot of the slides that are just bullet points full of information that I'm going to be saying anyway, and like finding some way to replace it. I was talking about this yesterday.
Yeah, so you'll
replace it with some graphics.
You'll have the time to make it what you wanted it to be.
Yeah, yeah. So of course, I've got to do some homework now. I have to write about what Pliny thought about the Christians.
Oh, Pliny.
Oh, Pliny.
Wait, Pliny the Elder or Pliny the Younger? Because that makes a difference.
Oh, does it?
I presume.
Oh, I forget. I haven't looked at the
Make sure you check beforehand.
I haven't looked up the assignment on Wikipedia yet, so... This textbook is worse than useless.
For all you kids out here, don't do that. Wikipedia should not do your homework for you. Be nice, stay in school.
Were both Plinies the Emperor of Turkey or something like that, or the Ottoman Empire or something like that?
I don't think so.
Yeah, I don't know.
I think that Pliny the Elder was like a naturalist, and his son also did some writing. And I remember that one of them, I think, witnessed the eruption of Mount Vesuvius.
Huh.
But I could be insane.
Yeah, it could be. Does run in the family.
That and alcoholism.
Yes, and cancer and suicide.
And poor vision.
And poor vision.
And
yes.
excellent teeth.
Yeah, reasonably okay teeth.
Hey, I've never had
Lots
a
of
cavity.
hair.
Lots of hair. More hair than we know what to do with.
Yes.
I don't know. Hair and teeth seems like a fair trade-off for sanity.
Yeah. It's overrated anyway.
And not nearly as common as people think. Oh, I looked up that band that was playing the other time I was in your car, and it was Tongue with 2 N's.
Yeah, Tongue, yep. T-U-N-N-G.
I really like that song. That was
Well, which one?
the Bullets.
Oh, yeah. That's
It's catchy.
It is a catchy song.
So do you have much personal interaction with the shiny new social worker students?
I just started talking to one of them like today, because every time I see her, she's in the social work office, like doing something on the computer.
Mm-hmm.
I just sort of walk in, I'm like, they got you in the office all the time? Don't you go out and see any patients or anything? You know, you gotta go out there and have some fun.
And then she burst into tears.
No. She, but one of the other social workers pointed out that in a couple of weeks she's gonna have a 5-patient caseload all to herself.
Ooh.
So she's gonna do some of the fun stuff. But you know, the actual social workers have caseloads in like, you know, above 20. You know, they have a lot of people on their caseload.
Wow. Huh.
Not all of them need to be seen all the time. You know, some of them just need to be seen once in a while. So they don't need to be seen as often as on a nursing caseload. So the nursing caseloads are smaller because we have to see every patient at least once a week. But some might need, if they've got like wounds that need bandage changes or whatever, we might see them like 3 or 5 times a week. I picked up a Sunday overnight shift again. I haven't worked overnights in a while. I ran into the clinical scheduler in the office, and she's like, "Did you get my message about the Sunday shift?" And I'm like, "Oh, I don't know. I have to check to see if I'm working Monday." Forgetting for a second that I was talking to the clinical scheduler, and she says, "You're not working Monday." I'm like, "Oh, okay. Well, then I guess I'll take it."
Yeah, maybe you should just ask her to tell you if you should take a shift. Well, do you think this is a good idea? You know my schedule.
Yeah, I had to write her an email about that because she was scheduling me for like day shift and then overnight shift and then day shift and then overnight shift like over and over again, which is usually what I associate with people who are trying to get rid of me. And she's always like really standoffish and kind of like closed facial expression whenever I see her.
The fact that this is a pattern that you've encountered repeatedly is sort of sad.
Yeah. But then when I came back from being sick for a week, she like smiles all warmly at me. I'm sitting down. She puts her hand on my shoulder and says, "Hi, honey."
Aww.
And I had to like choke back my instinctual response, which is to snap back, "I ain't your honey."
God, you're just like grandma.
Yeah, right. Well, I mean, because it's, you know, something in the nursing homes that get other people not to do, you know? Like, this person isn't your honey.
It's overly familiar, and
Yeah,
some people find it...
Yeah, well, it's diminutive, you know? It's overly familiar, yeah, exactly. So, when people say that to me, I often correct them rather tersely. Nursing students. Oh, there's this nursing student. You should have seen the color drain out of her face when I said that to her. She's like, "You got it, honey." I'm like, "I ain't your honey." She's pale, went totally pale.
Whereas, if I was her, I probably would have asked if something could be arranged, or if you were sure on that.
Well, that would be nice. That would be nice. But, no.
Are you certain?
So I guess I was thinking about this the other day, and a way I could soften that a little bit is to say, "So and so, I love you, but I'm not your honey," you know, or something like that. You know, It's like, I love you, but I ain't your honey, or something. You know, there's got to be a better way to get that point across, I guess. Or dear. Or I know you personally have a problem with pumpkin.
That's just because it makes me imagine myself as bulbous and orange, and that's not really how I prefer to see myself.
Yeah. So I got an email from. Oh, were we talking about the whole bachelor? Yeah, we were talking about the bachelor party thing yesterday,
Oh
right?
yeah.
So I guess one of Ryan's friends said he would arrange it,
Oh, well, that's good.
and so that's good because I don't know who his friends are or what day, what his schedule is like or anything like that.
Or
So
what bachelors are supposed to do.
right, yeah. But he said something about getting rooms at the casino, and I told him like, well, I'll chip in for the rooms at the casino, but I'm not like sharing a hotel room with like 6 guys. That's just not gonna happen. Not on this trip, anyway. I was thinking about maybe, I'll have to bounce some ideas off of this kid, because I think I've got some connections at a couple of the clubs. I might be able to swing a VIP table or something.
You mean the fact that you know everyone who's ever stepped foot in New London will come in handy?
Yeah, it usually does. I know like people who do sound and stuff. Yeah, it's really weird that like our census, the whole census at hospice is like in between 90 and 100 people or so for all of New London County, like all of New London, Waterford, East Lyme, Stonington, Old Lyme, Lisbon, Canterbury, Colchester, like all these places.
I think there'd be more than 90 people.
Yeah, you'd think so. But there's like 90 to 100 people. And there's more than one hospice agency, too.
Oh, that's true.
Yeah, we're not the only game in town. We're not the only death and dying game in town. And
what a game it is.
Yes. In that small group of 100 people spread out throughout all that place, I routinely run into people that are connected to me somehow. Like one patient I saw not too long ago was the grandmother of somebody that I went to high school with. Another patient that I saw recently, his son-in-law was somebody I worked with at the group home for adult with mental retardation. And just random stuff like that. Even in the nursing home, the 40-bed nursing home, I ran into just random people that I never thought I'd run into again, like parents of kids my age I used to know in Sunday school and church, and somebody who was the director of or assistant director of a community theater show I was in years ago. It's a small world.
Small state, maybe.
Yeah, I guess. I guess one of the other factors in that too is that as people get older, they need more and more medical care. So maybe there's an attribution bias at play there. But then the other thing too, which I pointed out to somebody last night when they were talking about something that seemed like a coincidence, was that that thing where the chance of 30 people, out of 30 people, 2 of them having the same birth date is really high. It's like above 90%, like 95%.
Don't birth dates group or something?
It's
probable ones?
No, it's not. It's not the grouping of probable birth dates. It's that the way that assuming that the birth dates are totally randomly distributed among those 30 people, the way you would compute the chances of 2 of them having the same birth date is x factorial over 365, where x is the number of people in the group. So it's 30 over 365 times 29 over 365 times 28 over 365, and it like curves up towards 100% really rapidly. To the point where with 30 people in the room, you're nearly guaranteed that 2 people will have the same birth date. It seems like it's less likely than it is, which is one of those tricks of statistics.
Yeah, a lot of things about probability that, would seem intuitively right are totally incorrect.
Yeah. Like what?
Oh, I just remember reading about like just things that people instinctively believe as being more probable aren't. I forgot all the examples.
Oh, yeah.
Yeah. It was one of those. And here are mistakes that you probably made lists.
Oh, right. On cracked.com or something like that.
Yeah, I have to admit, I know those. everyone seems to get married or pregnant all at the same time?
No, maybe that's another one of those statistical tricks.
A lot of people I know are pregnant.
Well, they're at the right age for it.
Early 20s seems freakishly young to me. But then...
Well, it's old compared to the historical norms.
Well, that's true. I guess I just view pregnancy as this whole, oh my god, you have an alien abomination growing inside you. The horror.
Well, the advantage of doing it when you're young is you recover quicker and you have more time to have an adult relationship with your kids.
That's true.
Then the downside is by the time you're old and feeble, so are they. But then hopefully you've got some grandkids and great-grandkids.
That you're on speaking terms with.
Yes.
Always an important factor. Yeah, I just find the whole process viscerally disturbing. The one with the closed-off facial expressions. How did you want the
I don't
shoulder
know.
and was diminutive with you?
Yeah, I don't know. I mean, it's hard to tell. I mean, you know, women of a mature age are so, especially women of a mature age who work in an office are very skilled at projecting intentionally what, you know, they want you to think they think, you know?
But if she wants you to think that she likes you and to affect that she acts like she likes you, then really does it matter if she doesn't?
Well, I mean, the answer to the question, does it matter, it comes in the form of what do people say about you behind your back, you know? Here we are.
Thank you very much for the ride.